All right, everyone, welcome to this episode of Delano Podcast News. My guest today is Marsela Lopez. She is from the Child Guidance Clinic. She's going to be bringing up some really good information on mental health stigmas. So stay tuned.
Hello, thank you for having me. I'm glad to be able to discuss mental health illness and be able to destigmatize in that area.
Well, it's great to have you here on this episode. So what information can you bring to us today?
Well, it's just within our community, it's very common that when we have some kind of physical health problem, we will go immediately to the doctor to address it, whether it is a diabetes or so. However, when it comes to mental health, such as maybe having levels of anxiety or depression, that's more frowned upon. We're less ambivalent or less likely to address it immediately, because as we're in our upbringing, that's not necessarily prioritized. I mean, it's more than anything physical health. So some things that we're often told as we're young is males don't show their feelings, or get over it. Or within Hispanics, it's very common to just refer to it as nervios, but you don't give it its accurate label due to fear of judgment, fear of being of not being seen to go see a counselor. So that's part of the mission that we're seeking, is to be more open within the community with regards to mental health, be more open about it. Unfortunately, we've had untreated mental health diagnosis that has led to often suicides, for example. I mean, worldwide, based on the World Health Organization, we have at least 800,000 suicide deaths a year, which actually is the equivalent of a suicide every 40 seconds. Here in the United States, we have about 47,173 deaths by suicide, which is a high rate. Nevertheless, it's the 10th leading cause of death here in the United States, and it's the second leading of death within 15 and 24-year-olds. And common diagnoses in the U.S. are anxiety and depression disorders. So if we are more open about our emotions and the struggles we're experiencing, I mean, prevention is the route to go. And that's why we also provide outreach within our clinic. We go out to schools, and we're trying to be within the community by being here with you.
So, I mean, like you said, I mean, here, Hispanic-wise, this is a large Hispanic community. So, I mean, that's one of the number one things I thought about like that. It's like a lot of people are like, oh, just don't talk about it. You just got to get through it and everything. And that's like a number one thing that we kind of see as far as Hispanics. So, I mean, now I know you kind of deal more with children or like adolescents and young adults. So, I mean, is anxiety and everything with the way social media and like even just nowadays the way society is it even more problem now that you see anxiety and depression within students and young adults?
Well, I must say, I know there's a fear within parents that observing certain content might make them feel a certain way or might cause them to be a certain way. However, it's more than anything how they manage that kind of content, and having education and building that awareness and that discussion within the family circle.
So, I mean, like you said, discussing it within the family circle, but it's like culturally, it's a thing that gets brushed off to not really talk about it. How would one talk about it if that's the way that it gets presented and they get told that just kind of get through it? How do you move on from that? Or if you're someone that is going through something, you feel like that, how do you go forward on the next step to kind of get help for that? That
is primarily why we really trying to reach out to the families, get in their homes via home visits, via school, attending their back to school nights, even their community events, to provide psychoeducation to the families. I know there are certain barriers that are built upon from extensive upbringing and years of of stigma behind the mental health, and it's a lot of awareness and education and outreach.
So, I mean, education on that is important because, like you said, a lot of people don't have enough information about it. And when you look at mental health, the first thing most people would think in mind is, okay, either schizophrenia or any type of really major mental health problem, but they don't really realize that there is like anxiety and depression, just everyday things that people go through. Those are mental health problems that most people need to seek some kind of help or seek some kind of way to help them combat that. So, I mean, as a parent, how would I or how would anybody look, or how would they be able to watch to notice certain things and want to seek help for that?
That's why we try to discuss common signs, like, for example, within depression, you might notice higher levels of isolation. You might see levels of hopelessness. You might see levels of lack of interest in their regular day-to-day activities. The distinction between the anxiety and depression, within depressed individuals, is their level of hopelessness is the fact that they see an obscure future, compared to like anxieties, like more than anything, they have a fear for the future. That's their extensive worry about. And then it's checking in with your kids on a day-to-day basis, just opening up that door, that not because you see a counselor or you're crazy, because that's an often term that I get from community members, that if you go see a counselor, estás loco, or vas a ir al loquero, or they automatically connect it to what was in the past, having them in a safety jacket. Mm-hmm. And that's the common image they get immediately when they hear mental health.
So I mean, like you said, that's a common misconception in that. Now, how common is that in adolescents and young adults, as far as having mental health problems or any kind of illness that they might be suffering from? Is it pretty common?
It is pretty common within young adults and older generations. I mean, like, I'll give you an example. I mean, the highest within middle age, they have the highest rates of suicide, and within the whole U.S., Caucasian middle-aged males. So if you look at it carefully, at the end of the day, we gotta address that.
Is there a cause for that, or is there like any research that's been done to see why there's a rise in that? Because does it have to do with the environment, or are they changing social, like the way that everybody moves around their day, to like social media, to everything? Does that have anything? Well, I've seen that it does, but I just want to kind of clarify if you can kind of go more in depth on that.
It also, before you would hide things, and you also didn't have all these media outlets to be informed, or have news spread out in a more rapid pace. So it is partly the fact that information is more available, that it also seems like it's more common. However, in the past, it appeared less common, partly due to the fact that you would hide it. You would keep it within the home. You weren't as open about these kinds of mental health problems. So the media availability has helped open up to notice how big of an epidemic it is.
Now, what are some solutions to that? If that's the cause or something, if say you have a child that's the reason why their anxiety or depression, or that's what's causing that, what would be a good solution on a parent level, or would you just recommend directly going to see a counselor on that?
There's some items that you don't have to necessarily have to go to a counselor. It's more than anything, when it's impairing their ability to perform their daily living activities, then it's something to consider at outside help. But checking in on your kids, being able to have those kinds of discussions and provide them with the coping skills, whether it is, you know, if it is a counselor, but it gets to a point where there's in situational, environmental, and genetic factors that come into play. If some of the kids, it might be that they're going through a divorce in their family. It can be school, they're being bullied. So it's parental involvement. And then if it comes to a point where within the home you can't address it, that's why you have the mental health services available outside to help that.
And that's what the child guidance comes in to kind of provide that. So then they are able to meet with parents. Now, is that something that only has to be referred by school, or can just any parent seek the services of the clinic?
You can go on your own. We have days where we have walk-ins. We have days where we have scheduled assessments. We oftentimes offer home assessments if that's how much we are dedicated towards getting into the community, making ourselves available to you, the community.
Is there any other tips or anything else that inform-wise that parents would probably want to be have knowledge of, or anything to look out for their children or their loved ones or any friends that they might have?
Well, if you're referring specifically to, like, for example, depression, you will look out for an increase in isolation, maybe suicidal thoughts, maybe they're less interested to their regular activities. It's impeding their ability to perform in school. Their normal daily activities, they're not able to focus on them anymore. Maybe less interested in their own hygiene. Anxiety wise, you might see a level of restlessness, pacing, increased heart rate, or to an extent, there's a point where they may fear even items that they weren't usually fearful of. So those are common things to look out for within, like, depression or anxiety. Now, also, just real quick, I often try to open up with regards to suicide, because I know a lot of them hear suicide and they're very fearful of that word, because you don't know how to address it at that moment. But honestly, it's more than anything, discussing it is not going to put the idea in their mind. They already have that in their mind prior to you trying to open them up about it. So have that discussion with them, explore what are the building factors leading up to that, and connect them with whether it is the crisis hotline, or if you can't through the crisis hotline, then hopefully you can open up to counseling.
See, that's really interesting, because I like that kind of thing came up a lot, like to talk about whether you have thoughts of suicide or something's really bothering you, that you might think about suicide. And that kind of rose with that Netflix original where it brought out 13 reasons why. And that kind of brought up a whole can of worms and kind of thing. And some people were saying it was negative because, now it's putting it into their minds. But would something as simple as a online series cause people to have more thoughts of actually going through it, committing suicide, versus it being a thing, okay, maybe I should think about this and talk to someone about it? Or I don't know.
There have been studies where there have been copycat suicides, but I can't really disclose with regards to whether those shows increment it. But based on what the studies that have been performed within individuals who have committed suicide, those people, they had some kind of untreated mental health illness, or they somehow already had that in their mind. In any case, there's factors that might build on it, which is stressors around it that may escalate the situation.
So, I know you were talking about points and everything and how people can look out for certain things. But sometimes is it possible to not notice? Because I have had friends of that they have lost other relatives to suicide, and I've talked to them and they were just like, we didn't there was no signs, or that at the time they thought there was no signs. So I mean, is it possible for them to be? I know you said a lot of isolation sometimes can lead to that. So I mean, is it possible for just you not to be able to notice beforehand?
It is possible to notice when you're not informed about their circumstances, or you're not aware of what to look out for. You know, I mean, a little. I relate to that. I mean, I've had a relative myself who it went through that route, and we did not notice those signs. And but then after we noticed the signs, once we became educated about what might lead up to that, like it can be a terminal illness, which what occurred with that person, that we were unaware of that terminal illness. So it's different factors that we're misinformed or uninformed that we miss out on sometimes.
So I mean, do you have any last information or anything before? Is there anything else that you'd like to say to any of the viewers or any of the, I mean, because most likely it's going to be parents and students as well that might see this because it's going to get shared within this community. Is there any last words that you can say to anyone?
Our best interest is that mental health illness can be discussed in a regular daily basis, similar like you do with physical health. Remove the stigma behind it. And if you are feeling stuck, don't know how to manage the situation, you do have Child Guidance Clinic here in Delano available to you. We go out to schools, we go out to your homes. You can come to the office, and we do outreach as well to the schools to try to make ourselves available.
All right. Well, Marsela, I thank you for coming on this episode and giving us some information about that. If any of the viewers do have any need or would like further information or even services of the Child Guidance Clinic here in Delano, they have a phone number. It's 661-725-1042. And if you have any more questions or you feel like you might need more understanding or more help for a loved one, please feel free to give them a call. Again, Marsela, thank you for coming on to this episode, and you have a wonderful day.
Thank you for having me.
All right.